At some point in our lives, we all must have seen the video of the grandma who's trying to blow the candles on her birthday cake, and in doing so, she blows her denture out. How inconvenient would that be for all the denture wearers of the world? One such patient who was wearing his denture for last 10 to 15 years approached us to find a fixed possible solution instead of his denture. This patient was fed up of wearing his denture, the ill-fitting denture. He was not able to chew. Also, he was not happy with the look of the denture. So he wanted a permanent fixed option. He approached us in this stage. As you can see, he had a collapsed bite and he was almost 75 years of age. Considering his age and the resorption of his bone, we asked the patient to get a 3D CBCT done so that we can plan better dental implant driven full mouth rehabilitation for his case. This was his condition, the condition of the bone. The lower bone still had a little bit of space where we can plan implants, but the upper bone did not have much apart from the center bone. Here the sinus was invading, and that is why we suggested the patient gets a sinus lift procedure done or a pterygoid implant done. Patient was not willing for any kind of invasive procedures like sinus lift or pterygoid implants, so he opted for an all-on-4 approach for this case. For this all-on-4, we took the patient's permission as to how many teeth did he want. He was very much happy and cooperative, and he said he was happy to have even 20 teeth in his mouth. This is the digital plan that we opted for this particular case. 4 dental implants for the lower and 4 dental implants for the upper were planned, and this surgical phase was carried out by our implantologist, prosthodontist, one anesthesiologist and a critical care specialist. A team of doctors performed this surgery, and it was very much successfully performed for this particular case. We ended up giving 4 implants with multi-unit abutments on the lower jaw and 6 dental implants for the upper jaw. We planned for 4 but opted for 6 dental implants. In case if the patient faces failure of any implant, we will have one more implant to take up the load of his fixed prosthetic teeth. After the surgical phase was carried out successfully, patient was given a temporary prosthetic denture to wear after 7 to 10 days of healing period. And he was told that after the proper integration of the implants with his bone, minimum duration will be 3 months, and after 3 months we will plan the final permanent prosthesis. The second stage was to plan for the final prosthesis. These digital scans are very much predictable and precise, and that is why we opted for it. 3D scans help to frame the processes in a very better way, wherein we can incorporate all the teeth in a single row, and very precise planning can be done for the final fixed processes. This is how the digital scans were carried out for this particular case. These, as you can see, are the final teeth. The framework is utmost precise. These are premium ceramic processes, and these shall be fixed in the patient's mouth. The patient was very much happy. His first reaction on seeing these teeth was immensely amazing. It gave us so much confidence, and we are thankful to the patient for supporting us throughout the treatment and showing that faith in us for his particular treatment. This is the X-ray after the implants were placed along with the abutments. So this is what we ended up achieving, from a 0 to implant phase, implant to teeth, and from this is the whole journey of the patient. It took almost 3-4 months for this journey to end, but the end result, the end goal was achieved. The son was immensely happy, and he congratulated the whole team of our doctors to help his father chew his food happily and peacefully, the food that he don't want to sacrifice on for his rest of life.